The Psychological Wellbeing Service offers psychological therapy for people with problems such as depression and anxiety, but we see a whole range of different problems in the service, such as post-traumatic stress disorder, social anxiety, panic disorder and obsessive compulsive disorder, or OCD, but to name a few. In fact, it's not essential to have a diagnosis to access the service, and we see people who are having problems such as low mood, low self-confidence, worrying excessively, or feeling stressed. Our service tends to work with people with mild to moderate severity problems because the treatments we offer are short-term, which can vary from just a couple of sessions to weekly treatment over a few months. We'll decide how many sessions are right for people at the start of treatment. The main sorts of treatment offered in the service is CBT, cognitive behaviour therapy, or based on CBT principles. CBT is a treatment that focuses more on the here and now than the past, looking at how people's thoughts can affect the way they feel, as problems like depression and anxiety can make things seem more negative than they really are. The actual treatment can look very different from one person to the next, but the sort of thing we might ask people to do is to keep a diary of their thoughts. We might want to help people increase their activity levels, or we might want them to test out their thoughts and beliefs in an experiment to see if they're an accurate reflection of reality. Wanting to change is really important, and people may have to do some work in between sessions, so they need to come prepared for that. There are a range of other types of treatment available, but there may be some variability across the service, so that would be important to discuss at assessment if people didn't feel that CBT would be the right option for them. We also offer options online with a live therapist and online courses that people can work through at their own leisure, which are highly effective. So there are lots of options and will help people to find the right one for them. If we don't have the right option available, we will try to signpost the person to the right support in the community. At the start of therapy, we'll look at patients' goals and what they want to achieve, so treatments are very much tailored to the individual. We also ask people to complete questionnaires at each session, which are really helpful to monitor progress, so we know if people are improving or not. We see people at our bases in Cambridge, Huntingdon, March in Fenland and Peterborough. We also see some people in GP surgeries and other locations in the community. However, often the first contact with the service is over the phone, where we'll try to find out more about the person's problems and identify the best treatment for them. We know that therapy can be a daunting experience for people, so we try to make it as relaxed as possible. All the information is confidential, but we do keep in contact with general practitioners and write letters to them. But you can discuss any concerns with your therapist at the beginning of treatment.